Good morning to everyone as we continue to join the webinar. Welcome to Guidance for Gathering, this webinar that is co-sponsored by Church Health and Church Developers Network. We're grateful that you've taken some time to join us to discuss some pertinent things we should consider as we move toward reopening and doing so in faith and with facts. So, just a few housekeeping things we want to make sure we get across to you as we begin. On the screen, you'll see some information that will be coming up to show you how you can continue to stay in contact with us. This is another webinar in a sort of series that we've been doing. So if you haven't already joined our Facebook group, it's facebook.com/groups/clergy COVID-19. That link will be on the screen at the end of this webinar as well as, of course, churchhealth.org/FCE. We'll make sure that you're staying up to date on all the things that are happening with our corner of the response to COVID-19. Additionally, you'll get an email sometime after our webinar finishes with a recap and recording of this time and the fruitful discussion that I know we will have. And so as we get started, I'm going to stop sharing my screen and just begin to frame our conversation a bit on guidance for gathering and what to consider for reopening. And so we know that many things are happening in the city of Memphis and in Shelby County. And we wanted to begin by just giving you an update on where it is that we stand. And so the good news, the encouraging news, is that Shelby County's testing rate is around 8%. It's higher than the national average of 5.4%. And we know that having a robust testing capacity is key to stopping the spread and beginning to reopen safely. But we also know that coronavirus cases are increasing in Shelby County. This is due to increased social interactions and also a result of our expanded testing capacity. And so both of those things are going hand in hand with the increased social interaction, folks beginning to verge outdoors now that we're in the midst of phase 2, but also our expanded ability to test and to know when folks are testing positive. Speaking of phase 2 and our back to business plan, phase 2 has been extended through mid-June due in part to the steady increase in COVID-19 testing. And that means we must stay vigilant, each of us, by doing our part, practicing physical distancing, as well as wearing facial coverings, and of course, washing our hands. As part of that, Church Health has come up with a guidance for gathering document. It can be found on our website, and it's been live since, I said, around May 15th, 2020. Now, one thing where we have to start is that we all have to reset our expectations. As leaders, as faith leaders who serve people, who serve the faithful, and even as we begin to lift our stay-at-home orders, we have to reset our expectations about how it is worship will look and what things we'll be able to do once we gather. That means we have to plan wisely and plan collaboratively to make sure that we are doing so with faith and with facts. Understanding that the virus loves worship just as much as we do. And because we're gathering, that means that there is a large factor in which we could be transmitting COVID-19. And so, as I said, we're working with wisdom to make sure that as we reopen, we know that the virus could see our worship spaces as a potential site of transmission. We have to mitigate the risk while still being a community. So some of the things we've suggested and that we hope you might consider is phase in opening of your building, supporting the wider community efforts to contain the virus, whether that through be supporting testing efforts or just spreading the word, maintaining a robust sanitation plan in the common areas, continuing to stream as an option for those who may not feel ready to come back, consider modifying services such as shortening the duration and limiting the spread by practicing social distancing. But most importantly, and as much of the reason we've gathered here today, is to be a source of reliable information in your community. Spreading good, reliable information based on the best available information, making sure that all who gather with us and all who we worship with know the information that is directly impacting them in their communities. And so with that, I want to introduce our panelists for this morning. We have an incredible panel. And I'm again grateful for them for making the time to join us. So here we have with us today Ann Langston, who is the Senior Director of Strategic Partnerships here at Church Health. We also have Pastor Keith Norman, who is the Senior Pastor of the First Baptist Church Broad and VP of Government Affairs at Baptist Memorial Healthcare. We're also joined by Pastor Rolando Rostro, the Senior Pastor of the Iglesia Nueva Vida. I hope I said that right, Pastor. Spanish is never my strong suit, so please don't if I mispronounced it. As well as Pastor Daniel Henley of the Journey Christian Church, Director of Faith Formation and Engagement at Agape Child and Family Services, as well as a leader at the Church Developers Network, who is a sponsor with us for this webinar. As many of you know, we will also be joined by Dr. Elisa Haushalter with the Shelby County Health Department. She'll be joining us in just a few moments. And as we begin our discussion, Anne, I invite you to tee us off by just talking a bit about, from a legal perspective, some of the things faith leaders should consider as we move toward reopening, but also what it is that, how can they protect themselves as well as their parishioners and reopen safely? Anne?
Thank you, Joshua. Good morning, everyone. And thank you for taking the time to focus on thoughtful and careful processes for reopening and understanding what is best for your congregation as well as those out in our community. My first comment, of course, is a caveat, which is I'm not giving you legal advice, but if you need it on the points that I mentioned this morning, I encourage you to talk to legal counsel. You can always call me and I can refer you to someone that can help. In preparation for today's discussion, though, I did speak with some outside lawyers that often volunteer for Church Health and guide us on multiple things. And it's an interesting conversation in these times because, as we all know, every day everything is changing, or at least is subject to change. And one of the challenges for looking at legal perspectives on this is that there isn't much law. This is a new environment. We don't know what will come, what we will have done right, what we may have done wrong. So the bottom line and consensus among the legal folks in my conversations is the number one sign you need to have on your desk is that says, use my best common sense and judgment and think through the repercussions as you would on any other major decision. But let me touch base on just a few points where I think that has applicability. The first, let's talk about your staff. Some of you are sole pastors, some of you have other staff, some of you have volunteer staff or that seem like staff that come in and volunteer all the time. And those are the people that are going to help you move forward as you look at reopening, and you need to think about what you can do to be careful for their safety, but also what you need to know about taking care of them. First point I would make is if you don't have someone that's advising you on all of the employee-related laws and recommendations that have come out of the COVID-related legislation, you need to do that. There have been multiple issues of new regulations related to how we handle employee time off, how we handle those that test positive and need to isolate, and what those mean to you in terms of paid and versus unpaid employee time off. It can be found fairly straightforward on a number of different websites, and I will make a quick reference because if you'll write this down, and I don't have it up on a screen, but we can put it in notes after this meeting. The Society for Human Resources has a simple page that just talks about the Families First Coronavirus Response Act. And it lists common questions that with simple answers for you regarding paid time off, requirements regarding how you track all of that information, how you handle family medical leave and the like. So I would encourage you to be familiar or access that if you need to. But let's talk about the practical side with your staff, the big questions, and I know Dr. Householder and Jenny Bartlett Prescott will also address this. The big issues that are going to come up will include, do you need to test all of your staff? What is the requirements for isolation? All of those types of things. The CDC and our very, very well-led Shelby County Health Department are going to be giving you those options and giving you that guidance. Testing in massive amounts is going to happen in Shelby County, and a lot of that will be directed to people that are going back into communal settings and being in leadership positions in places like churches. So you need to follow what the availability of that is. But the most important thing that you need to say to your staff is, again, common sense. Number one, if you feel bad and you have anything that resembles a symptom that has been listed for COVID-19, you should go and get tested. And if you don't do that and you bring yourself to work and you expose other people, then there may be repercussions regarding your employment around that. You need for your staff to understand that they have a responsibility to keep other people safe. And that means even if they will be off work, that's when you need to know about whether they will be paid, whether you will have them on an unpaid process, and they might be have other resources available. But staff comes first in terms of thinking about reopening and how you will position those people and how they will be the leaders in terms of showing others how to respond. Number two is then, what do you do about people coming into your building? What are those things that you can do to protect yourself and your church and the elders and senior leadership of your church? Be practical. Post signs. We all can tell people 1,000 times that they need to wear a mask, or they need to social distance, or they need to continue to wash their hands. But if you will post signs on the entry and throughout your buildings about required behaviors, and if you and your staff will set those examples of expected behaviors with hand washing, social distancing, and wearing masks, and limiting the numbers according to what the local ordinances are requiring at this time, that will give you more protection than anything else. Document what you're doing, take pictures of the signs you put up, make sure that you record and keep the messages you send out to your congregation so that you will have that if anybody ever comes back and asks, what did you do and were you following the standards that were being recommended by the CDC and local ordinances? I can't emphasize enough how much you need to follow CDC and local guidance on everything you're doing. This includes the numbers of people. Right now we have a limitation on a gathering of 50 people. That means those 50 have to wear masks and they have to be socially distanced. That's a city ordinance that's issued and is a requirement that should be followed. That applies to all activities that you're doing in your church. Even if churches reopen, you're going to have guidelines along those requirements, and you need to be able to document how you're doing that and how you're communicating that to your congregations. So as I started out by saying common sense, there are no laws or legal precedents right now that exist on liability issues related to the virus. I will say it 14 times, following CDC guidelines, following our local ordinances, and using common sense are by far the best protections that you can have. If you need to confer with a group, I encourage you to bring the leaders of your staff, the leaders of your church, others, as you've done in these gatherings together, to talk about this and to use your best collective wisdom in terms of what you do. And then the last thing I want to mention that is often very difficult in churches, but pastors know this better than anyone, and that is there is a hard line to figure out regarding privacy of both your staff and your members. You have an obligation to keep health information about your staff private. You don't need to share that with your whole congregation unless you have someone that says, I really need the congregation's support. I'd like for them to know that I'm isolated and my family needs help. If you have talked on these other calls about being able to ask those questions of those in your congregation, if they ask for the help or they ask for you to tell people that they are ill and need help, that's fine. But that is not a decision for you to make. You must have the consent of the person that has whatever diagnosis it is. Now, we talk all the time about, Fred or Joe is in the hospital and this is what it is. But Fred or Joe has said to one of you on staff, I want the congregation to put me on the prayer list. I want the care team to be here taking care of me. That's fine. But going out and having conversations about, Jane had a gathering last week and 5 people in her family tested positive. That's not something you need to put out among the church members unless Jane has asked you to do that and the family members have all consented to having their names put out as being involved in that situation. There are reporting requirements, and you must make sure that your staff follows those through their providers, that they report if they're testing positive, but that is not your responsibility. We do need to make sure you track that and you know who they are, and if you feel that they haven't reported it, then you have that obligation. But Jenny and Dr. Householder can talk more about that. I want to be quiet and ask if anyone has questions. I assume we're doing this through the chat or hand raising, but I will turn that back to Joshua and feel free to ask anything you can. And if not, I will have offline conversations and direct you to additional help. I hope this is helpful.
Thank you, Ann. Actually, our questions, we're hoping that everyone submits them through the Q&A function.
Okay.
Use the chat. If you use the chat, we won't be able to keep track and see those questions. If you have a question, please put it in the Q&A, and we will answer those as they come through. At this time, we're going to pitch it over to our CEO here, Jennifer Bartlett Prescott. It's a little weird for me to say it because we call her JBP here. And she has been working closely with the Shelby County Health Department as well as leading our citywide testing initiatives, and asked her to speak a bit about testing and all things COVID from the health department standpoint. Jenny BP.
Sure. And I have a series of questions that the Faith Community Engagement team sent me. And if Dr. Haushalter is able to log in, I will be happy to pass the baton over to her. As we all know, she is incredibly pulled these days in many directions. So I'm kind of standing in as proxy. So the first question that was sent to me was, what's the goal of the health department's testing strategy and how can churches help?
Here's what I found.
And this is a pretty straightforward answer, I think, which is that The goal of the testing strategy, number one, is to make sure that people who are experiencing any kind of symptoms, mild symptoms, any new onset of symptom that you don't normally have an explanation for, as we know it is allergy season as well, but everyone knows their body, that we have easy, equitable access to free testing all over Shelby County. So we're prioritizing access to that for folks with symptoms, but we also know that we are seeing asymptomatic spread, and we want to encourage anyone who has had known contact with somebody who's tested positive for COVID, or someone who maybe has been around somebody with symptoms and you don't know their status, that you get tested as well. And certainly people who feel like they are in professions and jobs that put them in public touch points all day long, you have access to testing too. These are the highest priority people that we want to make sure we're getting in and getting tested. That's just the first part of this strategy. The next part of this strategy is really making sure that as we identify the cases, people who tested positive, we are helping make sure people can isolate at home and that their household contacts isolate with them, and that people who've been in touch with that person while they may have been contagious are quarantined. That's that kind of rapid cycling of isolation and quarantine that truly is key to the overall testing strategy. That's the whole point of a testing strategy. Where churches can be helpful, honestly, is in spreading that message. We are going to have more comfortable testing modalities, hopefully coming soon. I'm sure all of you may have heard the horror stories already about Q-tips that go all the way to the back of your head. And while that isn't necessarily untrue, I think one of the challenges we have seen through this whole time is that the information and the reality in today's truth isn't what it was a month ago. And things are constantly changing, but yet we may just remember the experience or the rules or the guidelines that were in place, back at the beginning of April. So staying on top of where testing is accessed, how to access it, and what that experience is like is really important. And I think, for sure, speaking from church health, we are beginning partnerships with churches to try to work on that trusted relationship as a way to access testing. The church has a very special role in our community that is a trusted role. And we need to understand if there's a different way that we can offer testing or communicate about testing that help people access it. And so giving us that information, so connecting with our faith community engagement team and letting us know what you are hearing. You are hearing the trusted voices and the confidants of your parishioners. So we want to know what the truth is about how do we help stop this spread. So I think Joshua at the beginning also addressed why we are seeing increased positive tests and cases since Mother's Day. It's not necessarily due to Mother's Day in and of itself. We know in Memphis, we have a great history of family events and families being together. And that spread of the virus among households and among gatherings is where we are seeing some of the reason for that growth. There is also just wider community spread as well. So where people gather and where everyone's touching the same door handle, that is where we are seeing those issues. But certainly we know on Mother's Day, obviously there's a lot more congregating of families, and that's one of the reasons that we saw an increase there. So the next questions I had were just about public gatherings. And Joshua, I think you touched on this at the beginning, but there's several resources for churches and faith communities. And I think our faith community engagement team has done a good job just compiling that so that if you can stay engaged with the information we have, we'll have the most recent recommendations from the Centers for Disease Control or from the Shelby County Health Department. But as we stand right now, we are in phase 2. So what that means for houses of worship is that the gathering of people should be no more than 50% of the building capacity, or 50 people or less, whichever is fewer. I hope that makes sense. So in general, the rules don't change no matter whether you're in a church or whether you're in a grocery store. It is keeping 6 feet apart, wearing masks, washing your hands, cleaning spaces. All of those things are the same. What actions can churches take to minimize the risk of infections for both congregants and staff? Really just following what I spoke to just then. I think there's been a lot of resources out about how to do online worship. That's not always possible. Getting creative. We know that outdoor spread versus indoor spread, there is a difference there. So consider outside activities or outside gatherings. Again, the 6 feet distancing between family groups and the masking and the washing of hands is true whether you're inside or outside. But we do know that where adults are gathered inside buildings is a more likely place where spread is occurring. And then I think that that has answered most of those questions. There is the question about singing in choirs, and the actual expulsion of air when you sing can potentially spread further than 6 feet, or we've heard stories of choir rehearsals that has resulted in kind of these super spreads of the virus because one person was positive. This is a situation where we're still learning. We don't have a blueprint on anything now, and so the masking and 6 feet distancing and the cleaning of spaces is, limiting the size of the gathering is true regardless of setting. I don't know if there's any comments or questions. I saw Pastor Norman unmuted, so.
And there was a few questions that have popped up in our Q&A that I wanted to get you to answer as a chance to honor your time. And speaking to, I guess what I'll call the 50-50 rule, about 50% of the capacity or 50 people, whichever is less. This is one that's coming from Cheryl Tratt. Does a church have a responsibility to check temperatures before they enter service? Or can churches recommend that congregants check their temperatures at home and stay home if greater than whatever temperature you would recommend or is the current guidance?
Yeah, I think this is it's true to employer guidance too. There's gradations of screening, right? And you have to make a decision about what you are going to do in your setting given your circumstances. But having a way for people to check their temperatures at home is certainly okay. We know that I'm actually very surprised how many people don't have thermometers at home. So you do need to have a backup plan for that if people don't have thermometers at home. And I just want to encourage that, the symptoms of COVID are much more than just fever. And so it's wider than that. And it's any kind of feeling of unwell where people need to stay home. And I think that's what we all struggle with, employers and churches and, places where people like to gather. People, even when they feel well, want to be around the people they love. And so how do you manage building that culture that when people when people feel like maybe I feel different today than I felt yesterday, and this doesn't have an explanation of why that is, that they stay home. But there's no requirement that you have to check temperatures at the door. That is certainly a higher level of screening, of course, that could help, but that also should not replace staying 6 feet apart, wearing your mask, washing your hands. It doesn't get, someone could have COVID and not have a temperature.
And so that's a good segue to the last question that we have on this topic about, just speak a bit more about the kinds of testing. And so does it test for the test that we're doing, does it test for COVID-19? Does it test for the presence of antibodies? You just talk a bit about what testing we're talking about.
Sure. So the tests that are available today in Memphis, regardless of what community testing site you go to, is called the PCR test. It's a diagnostic test that looks for the genetics of the virus. There's different modalities of delivering that test. There's some rapid versions that can maybe get results faster, but they're all at the core of it, that same kind of test. And what it is designed to do is to tell us are you infected right now with COVID? That is what that test does. And that is why we use that test to then trigger isolation and quarantine of individuals. The other kind of test that you might be hearing about is the antibody test. We do not yet have that in any kind of wide strategy implementation in Memphis. Once that test is demonstrating to our scientists, and there's great cooperation among the scientific and medical community here. It's not to the point yet where the accuracy of that test is at a level where we would use it to make any decisions at all. We also don't know, just because you have antibodies in your body, that shows that you may have infected by COVID in the past. We don't know how long you'll have antibodies in your body, how long does that last, and we don't know what kind of protection that may be. We will know those answers eventually, but we don't know them today. So the antibody test will be coming to our strategy here in Memphis. It's just not there now. And then the third kind of test that you may hear about is the blood test or serology test. And this would be kind of like a finger prick type screening, almost like a strep test would be, where you can do it very quickly. And it gives us a sense of this person may have COVID, and then you would follow up with the diagnostic PCR test. That kind of test, again, it's not on market yet. We don't have it ready to go. They still have to work on the accuracy of it, but that would allow for very quick and rapid screening when you're going to places like the dentist or any kind of place where they want to maybe screen you at the door or screen you very quickly without doing a more expensive PCR test that can take more time to get the results back. So, it's going to get better. We will have, more information and more testing abilities to help us understand who is more at risk, who may be spreading the virus, who may have protective antibodies. We just don't have those tools in our toolkit today.
Thank you so much, Jenny VP. I'm going to call you that because that's what I call you at Church Health,
Sure.
for stepping in and just sharing this pertinent information about testing and just how we're going to be living through this season. There are a few questions that have come in. We're not going to get to them at this moment because I want to continue this conversation by bringing in our clergy partners who have taken the time out of their schedule to speak a bit about their experiences and the challenges and the hopes they have as we all look toward what reopening may look like. And I want to start with Dr. Keith Norman, who again is the senior pastor at the First Baptist Church Broad. Dr. Norman, we know that COVID-19 is disproportionately impacting the African-American community, and was hoping you could take your time to speak a bit about the particular challenges that you have faced congregation and physical plant of your size as you've begun considering what reopening could possibly look like.
Well, thank you. I think I got right back in on time because I had dropped off for a second, but look at God's timing. And thank you to all of the other panelists. And should I just amazingly go away, it's because we're having technical difficulties. But we do have a large facility and a large membership. But there's always opportunity. First of all, let me say that we are doing the things to support our staff. We've made sure that all of our staff is healthy and well. And to Ann's point, we have defined what furlough really means for a sick person. And I think sometimes we have to clarify that because I serve in an impoverished community. I serve many people of color. And oftentimes we need to stress this fact that people are making a decision between risking infection and possible eviction. And so those realities are part of our community, especially in poverty, and impoverished people deal with this on a regular basis. It's not because they want to be out in the public, but sometimes it's because they don't have the same options of working at home like many of us do. And then here at the church, we have gone to secure the necessary PPE for our staff, and we've gone to secure the necessary PPE for those who help with our live stream and the taping of our worship services. And then also to make sure that we have it for anybody who comes into the building. There are temperature checks done daily. We have gone through the posted protocols of questioning people. And we question what that's going to look like when you have mass numbers or even small numbers trying to get back in. It can take you 30 minutes to check the temperatures and sign in 15 people. And so when you look at that, just saying 1 to 2 minutes per person, you're going to have people coming to church at 7 o'clock for the 11 o'clock service, you know, in a very large church. And that's exaggerating, but, you know, that's a reality. Another thing we've gone out to do is to look at what social distancing looks like in our church. We put dots on seats, and we begin to measure every other row and 6 feet with the circumference and with the right distance to look at what that really looks like. We can get 166 people in a building that's seated for 2,500. And so that really means you got to put some real thought into this to make it work. So one of the things that we have done is we've really embraced the Don't Rush campaign, which is to say to our congregation, don't rush back into this situation and risk the possibilities of health and health exposure. 2 things, and I'll move the conversation on. We're trying not to also send a signal of classism. If we're not careful, what we could do is invite the healthiest and wealthiest people back to church while saying to those who have underlying comorbidities, which I'll speak on in just a moment, you can't come. A church has historically been a place where people who had sickness wanted to come because they had their hope and spirit lifted that they could be well or that they were loved. They need touch. They need affirmation. They need to hear what they believe is encouragement, not just from the pulpit, but from the people around them. You know, when you've had cancer treatment on Tuesday, it's good to hear somebody say how well you look on Sunday. And that's a great part of the healing process. And so we're careful to not send a signal to the poorest people in our community and to those who may be ill or sick with underlying comorbidities to say that you can't come. Jesus said in Matthew chapter 4, bring me the sick people, bring them to me. And so I don't want to send a signal to say, stop, if you're sick, don't come. But there is some responsibility that we have to take in that. Finally, I'll say something about communities of color. Let's be very clear that we know in Shelby County that the impact of COVID-19 has had a drastic impact on communities of color, especially African Americans. And so we see that 65% of the deaths that have occurred from COVID-19 have been in the African American community, and upwards of 55% have been African American males of a certain age, maybe 55 and above. Sunday happens to be my 55th birthday. I don't want to be in that number. So I want to do everything I can to reduce that possibility for me and people like me and the people around me. So to give them information, credible information is good. Reuters just published a report, and maybe Jenny could help with this. I don't know if she's aware of it or not, but that 81% of the cases that we've seen in death here in Shelby County, according to our Shelby County website, says that those people had some kind of cardiac or cardiovascular episode in their life. They were taking blood pressure medicines or some type of ACE inhibitor that was possibly interfering with their ability to heal. I'm not a medical doctor. I do work at a hospital, but I recognize in the African American community, a lot of people take blood pressure medicine. And so we don't want to do anything that would bring them into an environment and further complicate it. So we're thinking it through. We're making sure that we get the data. We're making sure that we apply that data to the specific group that we serve. Now, keep in mind, for many other pastors, this may not be the same situation. We looked at our database. We look at our age groups. We look at those who are of the age range where COVID is impacting greatly. So we've made sure that we're applying that information to our congregation. And so I think with those things, we have, a lot to do and a lot to help. I'll say one last thing. We have a responsibility, and I say we, pastors like myself and others, to stand in the pulpit and also to dispel rumors. So much of the information that has gone out has been confusing to people. One of the reasons why we probably still have capacity in our testing in some sites around the city has been because people have heard awful things about what this COVID-19 disease is doing or will do, or how it came about. I think it is responsible for my ministry and for me to stand up and say, no, that's not true. That is not what we know. Now, I won't argue with why people think that way. Obviously, some have reason, especially people of color. Some have reason to believe, of course, because of things like Tuskegee and unfortunately the recent situation we had with the mask that had Silvadur in it. That is a concern, obviously, but we have to dispel rumors and bring about valid information as much as possible. So as we go about the opening and as we start opening, bring into context your church environment. How does your church assimilate? How do they gather? How do the people relate to one another? We are what I describe, we always say a love to love, touchy, feely church. I mean, people are always embracing and hugging and high-fiving and all of that. And so that assimilation process, as you mentioned earlier, Joshua, has changed, and it's going to have to, you're going to have to think that out. We've gone through the restrooms and retrofitted things. We've put sanitizing stations all around the building. We're still looking at entry points. Where do you come in, and how many people will need to be there to check temperatures, and what's the most number of people we can get in the building at any one time. A service is no more than an hour, and then it's sanitized in between if there is another service to follow. Funerals are a totally different thing because there's, we know that the greatest spread has taken place in funerals in African American churches. 14 bishops from the Church of God in Christ and other pastors have succumbed to COVID-19 because of their assembling practices. And they were not all bishops in the Church of God in Christ, but other faith leaders. And then we've had outbreaks at churches since May 21st and May 24th, and they've had to shut back down because they have infected at minimal 25 people in one, and at maximum we've heard is 180 in another. And so these kinds of things have to be well thought through, and you have to do as much as you can to prevent it. And so speaking specifically from a community of color, we're taking a lot of data and a lot of very specific approaches to consider our congregants as well as the need. To satisfy the need, we're using every virtual platform possible. We're using television and also a major layout of activity to keep people engaged throughout the week.
Thank you so much, Pastor Norman. And I want to now engage Pastor Rolando Rostro of the Iglesia Nueva Vida. And as he begins to speak, I just want to let everyone know that we see your questions, and we're going to work to make sure we get answers to those even after the webinar from Jenny VP and the sources that we have here at Church Health. But Pastor Rostros, could you talk a bit about what your experiences have been and base a bit about on what Pastor Norman spoke about testing and what role testing has played as you begin to consider what reopening looks like for you and the community you serve?
Well, thank you, brother. I appreciate this topic, and I appreciate the lineup that you have here. Thank you, Dr. Norman. That was just great stuff that you mentioned there, and all of you that have said so many things. One of the things that we've seen in our culture, I mean, because we're talking about sometimes different demographics have different situations going or around their particular community. And ours, we have had some problems on communication. Most of everything that comes out is in English, and very few, if any, is in Spanish. So we're having to find a way to get the information out to our community, to our members. We got 3 churches in Memphis, Tennessee. And so we're trying to get everybody informed on exactly what to do, what not to do. That has been very challenging. Trying to make sure that we're current. And then sometimes even CDC, as new information comes out, as we learn more about the virus, there's new material, new insight. And so it gets updated. And so now the information we might have given in April or whatnot is different now. And so that has been kind of our challenge with our community. Also, there's also this cultural thing where going to the sites where they have the COVID testing, sometimes it's not a familiar place. Churches tend to become a place of refuge and be having familiarity. So it creates sometimes a barrier on people actually getting tested, the amount of people getting tested versus the amount of people that are really getting tested. So I get called also on so many things from our community on what is actually going on out there, what's happening, where's a good testing place. I've got a good relationship with Brother David Rogers there, son of Adrian Rogers. He works at our community clinic there close to the Winchester location sites. And so when he has testing there, we try to work with him and whatnot. But I would like to have testing at the churches. We give from the food bank through our churches, but I don't know if there's a way where I'd actually invite the community because a lot of the Hispanic communities is where they trust to come. And I want to see more testing done in our community. And because of the language and the culture barriers, a lot of people are not getting tested, and they need to get tested. And so that's kind of one of the things that I want to share. Also in the church setup, what we have done is basically get most our staff and leaders to come to the first, second service, just to get them trained up as far as how to receive the community, how to receive the members. We have a membership of about 600 people at the Winchester site, another 200 or 300 at the other 2 sites. And so we want to get everybody ready. And so there's a psychological preparedness in our community and coming together again. And then there's a spiritual preparedness. And so the man part of all this and what we're talking about now is having the place ready. And so we have our leaders come together for the first, second service, and our staff. And we have service, but we also have instruction for them on what they need to be doing. We also have already the chairs placed at 6 foot distance from each other. And so we can get them ready, our community, because a lot of misinformation, the adequate information isn't translated or doesn't get to them as soon as they can. There's a lot of misinformation that does get to them. And all those things create so much fear and panic that then it creates a trust factor. Is it okay to do this or not to do that? I mean, I've had people call me that they do not want to get tested. Their children are sick, they're sick, they've got all the symptoms, but they don't want to get tested because the information out there is that they're going to take their kids away, they're going to take their family, their wife or their husband or their children, they won't be able to see them again. This is what they heard that it's occurring on their countries, from Ecuador or from any part of Latin America. The other countries are taking other kind of steps that are very intense. And so they're hearing from their own family members what the other countries are doing. And so they think that this is what this country is doing too. If you go get tested and you come up positive, they'll take your kids away and whatnot. And so that kind of thing creates just a lot of unrest in our community. So as much as we can do to address something that's citywide in their language and in sites and places they can trust, this community in particular is better off. We're going to be better off in doing so many things that way, whether it's voter registration, whether it's COVID information, whether it's food drives. I mean, we open up our food drive and we got 1.5 to 2 miles long of vehicles just waiting in line trying to come through. So because they trust and because they come and all it is just Facebook information. We put a social media, tell them we're going to have this at this church site, and they will come. And that's kind of where I guess our community, the language issue, the trust issue, becomes a concern as far as trying to really reach and test all the community in Memphis, not just because this disease it's not a respecter of people, whether color or class. It will go to anyone and everyone. So as much as we can, as much as we do, we have to, I think, understand that the demographics of Memphis are so extent now. And the Latino community is a huge part of the population now. It's not a small part, it's a huge part of the population. And so they're working, they're blue collar, most are blue collar folks working on the construction sites and doing a lot of landscaping and whatnot. And so they're in the impoverished type of community, and they have to go work. They have to go do this. They don't want to break the rules. They don't want to not do what they're being told not to do, but they also have a need to supply or provide for their families. But it's a very religious community as well. It's a family community. It's a working community. It's a religious community. They want to go to church. But all the information out there, they don't know how to approach this, how to come back to church. But they want to be in church. They want to come back to church. They want the churches to come to be open because they have a need. There's a spiritual tendency in our Latino community. Most very Catholic, some Protestants, but in whatever line you follow, you want to come to church and you want to worship with the Lord. And so we're trying to create that pathway in a way that everything is sanitized at church, but in processes to get everybody, with a new norm. Our culture is very touchy. Pastor Dr. Norman mentioned that, very touchy, very feely church. The community, it's a very family. We've got 4, 5, 6 families in one home. Usually, if there's a family in one block or one apartment complex, you'll have the next 6, 8 family members in that sector. I mean, we cluster. The Latino community clusters that way. And so, if you have one family member that got infected, you will more likely see the other family members somewhat related to that because they're so close to each other. They see each other, they take care of each other. That's what this culture does. And so I want them to get tested more. I think the best way to do is if it's possible, have it at a church site to really reach the Latino community and get them tested. Thank you
so much for that, Pastor Rostros, and for lifting that up, for giving us this guidance as we continue to chart forward and on the church health side about what community testing might look like. We've just begun that kind of community testing this past week at St. Michael on Summer Avenue, but that we need to continue this kind of partnership and with trust and with care. And so thank you for your perspective. And I want to, yes. Please.
And our church is open for that. If you need, our church is open for that. We're willing to partner with anyone to do that. Thank you.
I would also mention that we are testing on the 19th and 20th of June. We're trying to do as many as possible. We have a huge testing site here at our church with Christ Community Clinic, which is a partner in this process, not to take away from church health, of course.
Yes, indeed. And as we learn all the different testing sites, as I get messages about them, I'll make sure to shout them out during our webinar. But I want to turn to Pastor Daniel Hindley of the Church Developers Network, and just to speak a bit about what your experience has been as you've been resourcing churches of many size, but particularly our smaller faith communities, and some of the challenges they've lifted up, but also the ways in which you've been finding creative ways to address them.
Sure. First of all, I just want to thank you for the opportunity to be here. This is a blessing to be able to partner with the Church Health Center. And as the Church Developers Network, that's one hat that I wear. I also wear the hat of, the Director of Faith Formation and Church Engagement at Agape. I'm so grateful to wear that hat. It's like Keith, He's a church, he's a pastor, he's also with Baptist. He's a trusted voice in this community. We also work with Methodists and Albert Mosley, trusted voice. Jim Schultz at Christ Community, trusted voice. Church Health Center, we trust your voice. Our job is to make sure that we bring to the network trusted voices. We got about 1,300 pastors and ministers on our network, and they trust us. They trust us to bring the right information. Rolando's my friend. You know, and Esther talked on Saturday saying, okay, this is what we're trying to accomplish. We ask a lot of questions. And it's because when we bring it to the Hispanic community, they need to trust us. Our job at the Church Developers Network is to be a facilitator, to be a convener, if you will, figure out how to get resources to our churches. When this whole thing happened, the first thing we said is, now we got to figure out how to give online. Work with the Church Health Center to do that. My good friend, Travis Moody, we asked him to come in, and boy, he did a wonderful job. Then we had to get our churches online. So we had a webinar. We brought in the experts from Life Church. They do this every Sunday. They taught us how to get online. And if you didn't have the money to do it, we figured that out. We asked people to sponsor, and some of the larger, more resource churches have helped us tremendously. So we helped with that. And then when this thing came out about stimulus packages, our churches didn't know how to do that. We had a webinar where we got the best and brightest. They taught us how to do that. If you still needed some accounting stuff, we paid for it if you couldn't pay for it. And I say that to say, we're in this together. The way they're going to believe is they're going to see us working together. Right now, we're working on a project with my good friend Rolando. Well, Bellevue is sponsoring, and we're going to feed over 3,000 people at 3 churches. One is Pastor Orlando's church, one is Pursuit of God in Fraser, and one is our good friend Tyrone Hunt in Whitehaven. And you hear the term Bellevue loves Memphis? Absolutely, man. Bellevue loves Memphis. Now, they're not going to stay up here and brag about it, but we're working together behind the scenes. You know, Bellevue has now given a $4 million building to Pursuit of God Church. I guess what I'm saying is we're doing things. We're working together, blacks, whites, and Hispanics. And a lot of times we don't see that because of some of the negative connotations that are going on. Don't get me wrong, very sensitive to what COVID is doing. I'm very sensitive to Mr. Floyd that was killed. And I will also tell you could be the finest hour of the church. We'll raise up and we'll work together, all of us, big churches, small churches, black, white, Hispanics, will come together in a definition of hope. The definition that we use for hope is real simple. Hope is an earnest expectation of a brighter future and a knowing that I have a role to play in making that happen. I'm saying that one more time, I'm not going to preach, but hope is an earnest expectation of a brighter future and the knowing that I have a role to play in making that happen. But our role at the Church Developers Network is to be a facilitator, a convener, a conduit, if you will. There's no way Agape, or Church Developers Network, can do all the work that's being done. Oh, but when we pull Second Presbyterian Church, George Robertson over there, he just did a webinar for us, talked about mental health. One of the best webinars one of the best talks we've had since I've been a part of the Church Developers Network. Let our pastors know they can be vulnerable. If you need help, mental health, go get it. Pastor Dan Henley, I go to the Employee Assistance Program that's sponsored at Methodist Hospital through Agape. Yes, sir, I go. My wife goes and my children go. Why? Because if I had a toothache, I go to the dentist. We got some mental stuff going on. Let's go get some mental health. So I guess what I'm saying is we're all working together. When it comes to COVID, Pastor, you ask about testing at the churches. Yes, we can get that done. I just talked with Dave Worland just this morning. He's the Office of Faith for Governor Lee. He said the churches, we want to do it at the churches. We'll help pay for that. But he also said that there are 96 counties in Tennessee, 89 of which fall up under the governor. Others, because they're so big, like Shelby County, they fall up under Alicia, who was supposed to be with us today. She's the director of the health department. So I guess what I'm saying is we're always looking for resources to be a blessing to our churches. We love the church. And just so grateful for you guys, partnering with you guys. Thank you so much for the opportunity to speak. I hope I didn't preach, but I'm okay. So that's what I do. I don't know.
I was waiting for you to take a text, Pastor Dan.
Amen.
But thank you for lifting up the reality that we're in this together and that we will overcome by being together. And the scripture says that we're overcome by the blood of the Lamb and the word of our testimony, but we will also overcome COVID by working together collaboratively, smartly, sharing our resources. And to that end, we want to make sure that all of our participants know that following the conclusion of this webinar, give us a little time to get it together, but any of the questions that were submitted, particularly around health concerns or guidance, we're going to work to get those answered and included in the email recap to you. But make sure that you are joining our communities. The Church Developers Network, as Pastor Dan said, hosts webinars and is a place of resource for pastors of every walk of life, every stripe and kind. And as well as the Facebook group, we'll have the link on the screen for Church Health so that you can see where resources are, how you can partner and go deeper into this conversation. As Ann began this conversation, we need some common sense, and what better common sense than to make sure we have wise counsel surrounding us. And so my hope is that everyone who has had a chance to join us here will continue this conversation in the communities you lead, in the communities that you're a part of. Look out for the resources that will be coming in the email following this webinar. And lastly, pray. And on that note, Pastor Dan, I'm going to ask you to close us in prayer.
Amen. Thank you so much. This is the way we end. Prayer is not preparation for the battle. Prayer is where the battle is won. Father, we love you and we love each other as we love ourselves. That's what you told us to do. Thank you for allowing us to serve. God, we just want to be a blessing to your people. Thank you for the Church Health Center and Dr. Scott Morris and the whole faith and engagement team, the church engagement team that they have. What a blessing. My good friend Sterling and Lauren. And thank you, oh God, for Joshua. We blessed them and Jenny as she came on, the CEO. And God, we blessed Keith Norman and all the leaders of these great organizations you called to be a part of the solution. Thank you for my good friend, Pastor Rolando Rostro and his wife, Esther. We blessed him, God. Now, as we leave this place, but never from your presence, we just want to say thank you. In your son, Jesus' name, we pray. Amen.
Amen. So once again, if you are participating, you have a question that has not been answered, you can go ahead and drop it in the Q&A section as we begin to close. Additionally, you can reach out to us via our Facebook page, and I'm going to go ahead and share my screen so that the link to that is available for everyone. And lastly, my prayer is that you will be well, that all manner of things will be well with you and the communities you serve. So those questions in the Q&A, if you don't have a chance to do that, reach out to us on Facebook or via email. That information will be on the screen in just a moment. And we thank you for taking this time. Thank you to all of our panelists, to Pastor Dan, Dr. Norman, Ann Langston here at Church Health, to Jenny BP here at Church Health as well, Pastor Rolando Rostros. Did I catch everyone? I hope I caught everyone. Just thank you for taking this time to speak about what things we all should be considering as we move toward reopening. Thank you.
So Joshua, somebody asked a question and I was going to type an answer, but I hit answer live, so I can't go back. But I'd like to answer this because it's a good question. Can the church require people to wear a mask or only encourage? At this point,